My name's Laura Braithwaite. I'm a speech and language therapist working in dementia care in North Wales. And this afternoon I'd like to speak to you briefly around our Life Story Work project and thinking about different approaches to carrying out life story work. So first of all, people aren't aware, so life story work is a psychosocial approach to supporting people with dementia. And it supports people to recall and reminisce about information throughout their lives that's important to them and has good outcomes in terms of well-being, communication and meaningful occupations as well. So Tom Kitwood was a key researcher in dementia care and proposed that life story work is fundamental in providing care that's person-centred. And sometimes it takes the form of a book. Traditionally, it can be a piece of music. And it's something that is provided as part of quality post-diagnostic care by speech and language therapists and occupational therapists as well. Unfortunately, due to COVID, we weren't able to provide this intervention, and we were concerned that there was an increased risk of mental health needs amongst people with dementia, potential decline in skills and abilities, and also decline in communication and opportunities to socialise as well. We became aware that there was the opportunity to apply for COVID-19 funding through the Arts and Health Coordinator within the Health Board, and the opportunity to think about delivering traditional interventions creatively. And also this is at a time when there's an increased focus on the value of arts-based approaches to support well-being with people with dementia. So this is how we then looked at putting together a group therapy package between myself, the occupational therapist in older people's mental health, and also our therapy coordinator. So just to think about the different areas of focus that we had. So for speech and language therapy, what we want to create is a supportive communication environment, hopefully improve people's opportunity for interaction. And potentially, by getting the person to reflect on things that are important to them in their lives, there's that preservation of core vocabulary as well. So potentially for names of people, places and objects in relation to that person's life. In terms of occupational therapy, it's around preserving identity. So thinking about that person's role in their life and also engagement in meaningful activity. And for art therapy, it's providing that person with an alternative form of self-expression about their lives and meaning making. So what does their life mean to them? And also what does that mean in the context of their diagnosis of dementia? And that's how we've arrived at a creative life story group. So for the format of therapy, people with dementia are referred to myself and the occupational therapist when they're newly diagnosed with the condition. If they've got concerns around not engaging in meaningful activity or a decline in their communication, for example. So we would complete a full communication assessment or OT assessment, identifying that they may be appropriate for this life story group if they're able to participate. So after completing therapy outcome measures, so TOMS, we are going to be offering people 8 weekly sessions. And this is going to be carried out on a virtual group platform. So we've been waiting, there's been a bit of a delay in starting, and that's because we've been waiting for an appropriate group platform to use really. But it's now been decided that we're able to use Zoom and this is going to be the preferable platform going forward. There's going to be a maximum of 10 service users, and that's so that we can create group cohesion, that feeling of safety, but also not having too many people, reducing opportunities to pay attention and reduce distractions and things like that. And there's going to be a different theme each week, depending on the types of people who are referred into the group. We'll choose themes that are related to their interests. So it could be things like holidays, it might be previous jobs, occupations, hobbies and interests. And these themes will be explored with the support of, at the moment, we've got 2 artists, although we think there's going to be more. So we have the support of a poet and also an animator illustrator. And prior to each weekly session, we're going to be sending out creative packs to each person's house with materials and stimuli for the sessions. And then during each online session, Myself and the occupational therapist will be completing observational tools to look at the level of engagement of each person in terms of their abilities for function, but also their communication as well, so non-verbal and verbal communication. And we're hoping to get qualitative and quantitative data as outcomes for the project. So we're hoping to see increase from baseline in the engagement and interaction across the sessions for each person. We're also looking for those light bulb moments, so those times of real well-being, a real sense of engagement from each person. We're hoping to gain accessible feedback through talking mats, so asking each participant what went well about the sessions, what they would change next time as it's a pilot. There's going to be a life story product for each person, so for someone it might be a personal word dictionary that they've created through the project. Through the use of poetry maybe. For somebody else it could be an animation that they've created or a piece of music. And then as a byproduct of the sessions, we are going to be providing training for the artists around dementia, around, for example, the work of speech and language therapy in dementia, occupational therapy, and they could take those forward in future projects that they carry out in connection with the health board. And then hopefully from the creatives, the artists themselves, we will be able to have a toolkit that we can take forward in our clinical work. So it might be that we'll be able to combine arts-based approaches with some of the more traditional speech therapy activities that we do with people with dementia. So here are a list of references related to the project. I'm happy to distribute these if anybody's interested. And any questions, I'm more than happy for people to contact me either via email or follow me on Twitter.